Mental health awareness has been an ongoing issue for many years. Over the years, we have searched for treatment and cures for disorders like autism, a developmental disorder that affects the victim's ability to communicate, depression, another serious problem that causes the patient a depressed mood and lack of interest in activities they once enjoyed, etc. Post-traumatic stress disorder, or PTSD for short, is one of them. PTSD is a condition caused by witnessing or experiencing a traumatic event. PTSD has been an issue of note since World War I and continues to be of notice. People with PTSD can experience sudden flashbacks of the event, the avoidance of people, places, and activities that remind them of the event, negative changes in thinking and mood, and changes in their physical and emotional reactions. The intensity of these symptoms can change over time. While veterans of war are the demographic most associated with PTSD, there are other groups of people who suffer from it as well, such as victims of childhood abuse, rape victims, those who have been physically assaulted, and those involved in a vehicular accident. The effect of PTSD on society is negative, as if a person were to see a soldier come back from war with the disorder, it might frighten them from joining our armed forces. PTSD can also make someone mentally unable to contribute to our society, as it will be difficult for them to find work due to changes in how they physically or emotionally react. They may have trouble with concentration. PTSD can even make a person a danger to their family and friends, as the increase in the aggression that the disorder causes can make them have violent outbursts against other people. Other common side effects that come with PTSD are depression, anxiety, drugs and or alcohol abuse, eating disorders, and even suicidal thoughts or action. Keep in mind that 5% of the U.S. population suffers from PTSD. That means that 13 million people in the United States alone suffer from this disorder. While therapy is an option to treat PTSD, there has been a medication known as prazosin that lowers the blood pressure to keep the victim safe from bodily harm, but it does not help their mental state. The best thing we can do to help those with PTSD is trying to talk to them and listen to them so that we may understand their problems and find ways to help them get over the event. And hopefully with time the victim may accept that the event happened and recover from their horrible experience, and they can become a better presence to their friends and family.